Oh, poor boy. What's happening to him? Is it due to a respiratory disease? Let's find out more details. Respiratory diseases encompass various types. However, let's focus on asthma and chronic obstructive pulmonary disease. Asthma and COPD are a chronic lung disease. It causes breathing difficulties throughout a person's lifetime. Lungs react sensitively to triggers, which are things that might not affect other people. If asthma is untreated or poorly controlled, structural changes in the airway may become permanent. 1. The airway becomes small and irritated. Inflammation narrows the airway, making it hard for air to flow through. 2. Asthma can lead to increased production of mucus, further obstructing the airway. 3. Muscles surrounding the airways tighten, reducing the opening even more. When someone with asthma encounters triggers, one or all three airway changes can occur. This is known as an asthma attack or COPD. All these changes collectively contribute to the narrowing of the airways, making it difficult to breathe. To manage these diseases, we utilize drug delivery methods, which nebulizers, dry powder inhalers. Inhalable medications for asthma and COPD can be confusing for both patients and prescribers due to the variety of devices available. Dry powder inhalers DPIs are highlighted as a valuable option. For many patients, active drugs in DPIs consist of microparticles, loaded in two larger carrier particles. The inhaler's design converts the patient's inhalation into forces that separate drug particles from carriers. Drug particles reach the lungs, while larger carrier particles are swallowed. DPIs are advantageous as they don't use harmful propellants, like chloro and hydrofluorocarbons. Activation only requires the patient's breath. Patient education on correct device use, handling, and storage is crucial at diagnosis and regularly thereafter, to ensure that this dry powder inhalers can be used to specifically deliver the drug to affected areas. Field emission scanning electron microscopy, or FESEM in short, is used for characterization. FESEM is an advanced technology used to capture the microstructure image of the materials. Instead of using light beam, FESEM relies on potential gradient to emit electron beams and is passed through a series of electromagnetic lenses to focus and manipulate the beam. FESEM uses a field emission gonfeg that features a single tungsten filament with a pointed sharp tip as its electron source. Due to its sharp tip, the formation of electron probe as small as 0.5 nanometers allowed a higher image resolution than in typical SEM. Furthermore, with low acceleration voltage, which is under 5 kilovolts, surface topographic images with higher resolution can also be generated. The FESEM setup is as follows. Firstly, the source of electron came from the electron gun, which will then go through a positively charged anode. This anode functions as a guide to produced electron beam. The next feature would be the first and second condenser lenses, also known as electromagnetic lenses, where it helps to give a proper shape to the electron beam. The electron beam is then passed through the objective lens. This device also features a backscattered electron detector, which is typically placed near the sample stage. The total system should be in a proper vacuum pump, so that the gas molecules will not disturb the electron beam. The emitted secondary and backscattered electrons used for imaging. In operation, the electron beam is generated and will strike the sample surface. The backscattered electron will be detected by the backscattered electron detector. It will also generate X-ray, which is detected by the X-ray detector. Consequently, the secondary electron detector will detect the emitted secondary electrons for imaging purposes. The system will then undergo a series of amplification and scanning process where the microstructure image of the sample is visualized. The characteristics that can help nebulizer to work efficiently. including physiochemical properties and aerodynamic properties. Drug penetration across membranes is complex and dependent on many possible physicochemical interactions. Physicochemical properties can be classified as molecular properties, such as density, surface change, or size. The size of the particles produced by a nebulizer is a crucial factor in determining its effectiveness. The particles generated by a nebulizer are typically measured in micrometers or microns. The ideal particle size for inhalation therapy is generally considered to be in the range of 1 to 5 microns. When the particle size is in that range, these are more likely to reach the lower respiratory tract, including the bronchioles and alveoli, where gas exchange occurs. This is the desired target for many respiratory medications. The morphology factor refers to the shape or structure of the particles generated. Researchers often conduct in vitro and in vivo studies to assess the impact of particle morphology on deposition patterns and therapeutic outcomes. These studies help guide the development of nebulized medications when applied to the study of particles generated by nebulizers or other aerosolization methods. FESEM can provide detailed insights into the size, shape, and surface characteristics of these particles. Some examples show the form of particles of ingredient that use in nebulizers. As mentioned, the physical diameter of the microparticles can sometimes be much different from the aerodynamic one. Therefore, the physical size evaluation is not sufficient in terms of inhalation delivery. Today, one of the biggest trends is to obtain highly porous MPs to increase their physical diameter so that alveolar macrophages cannot absorb them, and to keep the aerodynamic diameter below 5 millimeters so that MPs can still reach the deep lungs.
Thank you for your attention. Thank you for your attention.